Welcome once again to Living in the World of Dementia. And today we'll be looking at mental disorders. First, we want to address is depression in older adults. It's a common misconception that all older people get depressed. And it's a normal part of aging. An ageist attitude would be to think all older people have a lot to be depressed about and this should be accepted. There's nothing further from the truth. While some older adults may experience depression, it is not a normal part of aging and should be treated once acknowledged. This older generation often derives any admission to poor mental health. Neither help for depression or any other form of mental illness has a negative stigma in the older generation. When you were feeling sad, you were told to snap out of it and get on with life. We have learned depression is really illness that can be treated. It's not just feeling sorry for yourself. Older persons may experiencing life changes that are difficult to process. The death of a significant other, moving out of home into a care community, or dealing with complications of an illness or aging can cause feelings or anxiety and sadness. In many cases, the person may work through this with the support of family and care providers. In other cases, the person is unable to adjust and feelings of sadness along with other symptoms will increase. So we just want to dive into this a little bit. As you age and you get older, your mental psyche doesn't necessarily comprehend the way of living that they used to be. Now, the strange thing is that the slowing down of your physical well-being, mentally, biologically, physiologically, impacts your mind. You feel it on the inner part of you. And trying to cope with it is one of the most difficult things. It's difficult from the standpoint that you have a vivid and clear understanding of who you were in the past, but you can't come to accept who you are in the present. This causes depression because you can't set back the clock. You can't go back being young. And every day that you live, you're going to just get older and older and older. And in the process of getting older and older and older, your body and mind and spirit and soul is going to tell you, you're getting old, you can't do anything for yourself anymore. And then a load of depression takes over. Just try to wake up on mornings to recognize there's no workplace to go to. Just try to visualize on mornings you wake up and your young kids or middle-aged adults at this point is now getting up, taking off to work, and you're not sending them back to the latter part of the evening, or sometimes they're so busy they can't even give you a phone call and check up on you to see how things are going. Then you're in the house, you probably turning TV on and listening to the radio, reading the magazine, but there's no human life there with you. And that's a problem. And sometimes the more you absorb all of this activity going on in your life, it wears you down mentally. You start to speak differently. And then your kids or family members who used to know you as this vibrant person now recognize, well, look, they're really getting down and we can't care for them the way we want to. They think it's saying that we put them in a home. Unfortunately, that's where you're going to end up in a nursing facility. And it's a good likelihood now that the stress that you are now dealing with or trying to cope with, you're now adding additional stress on yourself because you're now gone into a new home. You don't know the people. You don't know those who are taking care of you. You think that somewhat your privacy is being invaded because someone got to bathe you, someone have to get you up, someone have to feed you, someone else have to do something in your life that your kids can no longer do because you're not admitted in a nursing facility. The mere fact that you're there every single day and every single week and every single month, and months turn to the years, and sometimes your kids or loved ones can't come and visit till maybe 3-4 weeks or maybe a month at a time or 2 months at a time. Hey, some years goes on that they don't even show, and you begin to feel a sense of neglect, and you're wondering how you can really cope and deal with this. And it's hard. It's really hard. So with all that compounded on you, it mentally weakens you. As a matter of fact, it also probably work on your immune system. With so much stress, it do work on your ability to cope with life. You have a way of starting to give up on life because you recognize physically you can't do for yourself. Things ain't working out, your loved ones abandon you. And that's what some of them come to. Their loved ones, they think their loved ones had abandoned them. And the result of that, problems break out even more in their lives. So it is essential to understand what this depression can do to all the folks in our homes, in our communities, and in our nursing homes. We want to talk a little bit about go on a little bit more about the depression. Depression can also occur with other medical conditions such as diabetes, cancers, and Parkinson's disease. These conditions will change a person's lifestyle and the ability to enjoy life to the fullest. Depression can make these conditions worse. Additionally, there are some medications prescribed for these conditions that have depression as a side effect. All staff should be aware of changes of mental status when being treated for such conditions. So yes, as a caretaker in a nursing facility, they should be fully aware that when certain medication is given to their patients or residents, that it can alter their mentality, it can alter the way how they see things and understand things because it has a negative side effect on it. And by the way, most medications have a side effect with it. It doesn't matter how they say how safe it's supposed to be, but it's far from the truth. Once identified, depression is treated with medications and psychotherapy, antidepressants, and medications designed to treat depression. There are several kinds of antidepressants, and they will take several weeks once administered to begin to work. It may take several attempts to find the right antidepressant for the person. Additionally, taken to the professional counselor can also be helpful in antidepressants for the person. Every person living in a skilled nursing facility is screened for depression through the Pattern Health Questionnaire, or PHQ-9, portion of the minimum data set. The PHQ-9 consists of 9 questions that help identify signs of depression. It is also used as a part of a regular health exam in other settings. So let's look at some of the disorders. We want to talk first about the bipolar disorder and what it really is. It's a lot of mood swings, actually. I'll read it for you. Bipolar mood swings include emotional highs and lows. Depressed episodes include feeling sad and hopeless with a loss of interest in doing favorite activities or pastimes. The emotionally high moods or manic moods are when the person may be full of energy. They feel you're fit and as they can do anything. The mood swings affect person's energy level, behavior, and judgment. Bipolar disorder is generally diagnosed as a young adult and can be managed with medication and psychological counseling. So we get a full understanding of bipolar. Bipolar has its mood swings. One day you can be up, one day you can be down. 1 minute you can be up, the other minute you can be down. You can be good for 2 hours, and the next hour you are down. It has its mood swings, and it can be managed with the right formation of counseling and the right medication can put you in somewhat a secure place of cognitive reactions to your everyday living. But it's a disorder that can be rectified from time to time based on the degree it has an impact it has on the person's life. Persons with this diagnosis are generally admitted to the care community during unmanaged episodes of their diagnosis. Patients begin to feel well on the treatment and make decisions they no longer need to take their medication. This unfortunately caused an increase in symptoms requiring more intensive treatment and placement in their care community for supervision. And this is one of the other things that happen with bipolar people. They take the medication, they feel great, they feel upbeat, and their life is going on normal. And they figure out, well, you know what, I don't really need to take this medication anymore. I'm doing well, I'm recovered. And from the moment that you refuse to take this form of medication, your life again goes right back downhill. And now it takes even more intensification of treatment in that person's life to get them back to a place of normal cognitive reactions to life. That is an issue, and therefore they must be supervised with their medication. It's very imperative that medical practitioners see that they have the medication. Not that you can force medication on anyone. It's their right to refuse if they want. But you have to do your best to insist that these residents or victims of bipolar disorder take the medication. It's to help them in the long run. We have a generalized anxiety disorder, better known as GAD. The federal regulations define anxiety as a common reaction to stress that involves occasional worry about circumstantial events. Anxiety disorders include symptoms such as excessive fear and intense anxiety and can cause significant distress. Anxiety disorders are prevalent among older adults and may cause debilitating symptoms. So we know what anxiety is supposed to be, and it's very important that we should be sensitive as caretakers with people who have anxiety. They're not bad people. It's just that coping with the stresses of life and what surrounds them mentally speaking, you have to be their pillow of confidence, of reassurance that everything's going to be all right. They're in a depressed mode, but they need to get out of it, and you have to do your due diligence in assisting them to do the right thing in life. Anxiety is evident in 10 to 20% of older adults and often goes unrecognized and untreated. Anxiety is not diagnosed because the older person is often reluctant to discuss their feelings. It also goes unnoticed among their diagnosis of medical conditions. It is not unusual for anxiety to worsen as a person ages because of declining physical health, a decrease in their ability to perform daily activities, and the decreased feelings of well-being. Common fears associated with aging are things such as falls, which could cause severe injury and need for surgery, being unable to afford living expenses, being dependent on others, being left alone, and even death. Anxiety is seen more in women than in men. If anxiety not treated, it can contribute to impaired cognition, poor physical health, and lower quality of life. So we see the essentials again of trying to motivate, encourage, and positively influence and impact the life of those people who are suffering from anxiety. That's essential because they can't help themselves. They become so much embodied in their daily living, and they're getting older. The realities of their life is factual. The experiencing of falls and unable to take care of themselves is detrimental mentally to these people. And they will need you to give them the assurance and reassurance that everything's going to be fine. Put a smile on their face. Be their pal, be their buddy. Do whatever it takes to make them happy and comfortable while they're going through this form of sickness, and enable them also to take their medication at all times. Another form of mental disorder, and this is one that really should touch everyone: schizophrenia. Schizophrenia is a chronic and severe mental illness. This disorder, which is genetic, link appears with a person in their age teens or early 20s. The person with schizophrenia experiences symptoms such as hearing voices, believing someone is controlling their thoughts, or paranoia. These symptoms often cause the person to withdraw from society and isolate themselves in some way. They may demonstrate outlandish and eccentric behavior, which may be frightening to others. These symptoms are due to chemical imbalance in their brain and can be treated with medications that are often effective. Once diagnosed, the person will need lifelong medication and treatment for this condition. Once a person regains functioning after treatment, they may choose to discontinue treatment. The person feel they are cured and do not like the side effects of the medication. This places them back in pre-treatment condition. It is not unusual for a person to disconnect from family because of this psychological behavior. Persons in care communities with this diagnosis are often the individuals who have difficulty managing their symptoms. Schizophrenia can be managed with medications. However, this requires consistent care by a mental health professional and psychiatrist. Like the bipolar disorder, the individual begins to feel better and may then stop taking their medication. Additionally, the medication diagnosis needs to be monitored for effectiveness. So it goes back again to tell you that even though we treat bipolar with some medications, it takes a while to really see what's working effectively, whether it have a long-term impact or a short-term impact. If you need to be flexible, this would be obviously the job of the psychiatrist to change medications and enable that person to live a more relaxed and comfortable life. The imbalance of this psychiatric problem, being a schizophrenic, is that you don't know when they are going to change, when they're going to flip and do something negatively. You have to monitor those people with the eyes of a hawk, so to speak. You have to be very prudent in the way you work and deal with schizophrenic people. In most cases, if the person is severely schizophrenia, it's wise that in the medical facility or the nursing facility that from time to time is essential, especially in the embryonic stages of coming to the nursing facility, that person should have a one-to-one monitor with them. It's essential to do this because schizophrenia just doesn't design to harm other people, but also harm themselves, or they're mentally so messed up is that they're not knowing what they're doing. There are commanding voices they're actually hearing in their head. You don't hear, you don't understand it. It drives them to do all kind of messed up things, include hurt themselves, kill another person. These voices speak to them, and these voices are real. This call for a very strong, severe monitoring. This should be always monitored one-to-one. It's essential that medications are also taken on time and that they are encouraged to understand the importance of taking their medication. We want to also look at, as we go through this form of mental disorders, we want to identify or figure out the ways of identifying when something is in the process to take place. There's basic things from normality that becomes abnormal. A person that is normally okay, decide to get withdrawn, the clenching of their fist, the gashing of their teeth, the rolling of their eyes, the trembling, the pacing, and these kind of hasty moves that they weren't doing an hour ago or a few minutes ago, tells you that something is triggering them. Just like autism, the noise levels have to be at its lowest decibels. They have to be placed in sensory rooms or sensory environments that enable them to be calm and enable them to operate at a normal pace. The hastening of other activities around them become triggers. It's normal for the everyday person. It's normal for some of the residents. It's normal for some of the patients. But at the same time, what is deemed normal for the patients or residents, or even you and I, are not normal for a person who's suffering from schizophrenia or autism, for matter of speaking. Some normal things become abnormal to them, and it becomes triggers to them. And this is why it's for the PCA, the CNAs, the caregivers, whoever you are. If you are working with a schizophrenia person, your consciousness has to be undivided. It has to be focused, because there's no signs that quickly that they can just flip and lash like that out at you and can either injure you or injure themselves. So a level of prudency and awareness of your environment and your patient, you have to be very cautious of. You have to be there to ensure that they're not in the process of hurting themselves. And as I said, keeping them on the sensory environments are often the best place for a person with schizophrenia. It should be an environment free from any forms of weaponry, any form of instruments that they can damage themselves with. It should be just things that they can play with, be it of plastic or rubber or some form of that. But schizophrenia is a very serious mental disorder, and we must also look out for not just the well-being of the schizophrenia, but also the well-being of their families. Despite of their mental incapacitation, they are the loved ones of a family. And we have to do our due diligence. We have to do our due diligence in making sure that they get the kind of treatment they need. We have to do our due diligence in making sure that they are loved, they are well cared for. With that form of mental disorder, we're going to leave it here at this point. This is section 5 of the aging process. And we know that all these things align, all these disorders and problems that we would have just been over comes through the aging process. Some, for the schizophrenia, obviously it has no age limit. It can happen to anyone at any given time. You can be born with it. It could be hereditary from generation to generation, that mental sickness. So I think it's very wise that we stay prudent, look out for each other, love each other as we love ourselves, and as caregivers and a medical practitioner, just give the best of you every day you go to work. And remember that these people you're working for and working with, they have family members. They trust you, they place their loved one lives in your hand, that you could be a beacon in their lives one way or the other. With that said, our next section will be on section 6, and that will be coming in the near future. And until then, you have a great day. Take good care.